this test is quite huge, like that one you watch even in the movies, and you're seated with your partner or your husband or whoever it is, and you're just waiting for that two lines, and everyone is so anxious. Hi, and welcome again to my bed. Come closer, get in bed with me, Dr. K. And today we'll talk about something so important, because I know so many people do it. Some people want to do it. Some people feel like, I hope it's not coming out positive. I hope it's not coming, oh my God, I'll never repeat this again, as other people say. Yes, I'm talking about pregnancy test. Now that you're pregnant, what next? And maybe you don't even know you're pregnant. Maybe you're assuming you're pregnant. So what do? So first of all, I would say that you need to get to either a pharmacy or in whatever that it is, a hospital, whatever it is, there is a test that can be done. The most simple test that you can do is the urine test. Most people do the urine test immediately they've not had their period. So if you have been planning for pregnancy and this month you didn't get your period, it's a week later or 2 weeks later or even 8 weeks later, you can be able to do a urine test and it will give you the right results. This test is usually done early in the morning. The first urine that you wake up with before you go to the toilet, you must make sure that you'll say, okay, fine, let me pick this test and go and do it. It's a simple strip test. Other people will use the gadget. The description of how to use it is usually written in that sachet, and it's usually accurate immediately after you miss your period. There are people who've been waiting for pregnancy, you've been having infertility, and you're like waiting, and maybe you don't have regular periods. Sometimes you're able to do this urine test, but it's preferably after you've had any signs or symptoms of pregnancy. I wouldn't recommend that you do every month, regardless of whether you have a period or not, because it can be frustrating to do this pregnancy test, because this test is quite huge, like that one you watch even in the movies, and you're seated with your partner or your husband or whoever it is, and you're just waiting for that two lines, and everyone is so anxious. So you can imagine if you've been trying to get pregnant, you've been termed infertile, and you have to keep testing. I would recommend you do it after you've had any symptoms, being like nausea, vomiting, or maybe just feel out of the ordinary. You can do this urine test. Better still, another test that you can do at the doctor's office, it's usually a blood test. Most of the time it will be confirmatory. It tests the same hormone but in blood levels. It can pick up your pregnancy even before the 5-week, 6-week mark. It's better than the urine test, but most people will get a positive test with the urine test. Another way some people might be able to know that they are pregnant is if they go for an ultrasound scan anytime above 6 weeks. So during that scan, maybe it was incidental finding, maybe you had an issue, you had pain, low abdominal pains, or you were vomiting, or you're just feeling out of the ordinary, or you had an abnormal period, and lo and behold, the radiologist tells you, congratulations, you got this. You have a baby coming up. It's a shocker. It's maybe good for other people, maybe for other people, and that's fine. So an ultrasound scan can be able to test your pregnancy. Most people who have gotten pregnant before can be able to tell that they are pregnant from the symptoms they experienced from the previous pregnancy. But I would advise that still you might need to confirm with either the urine test, the blood test, or even go to the doctor and have an ultrasound scan. So if you have, or you're wondering whether to do this test, if it's more than 5 to 6 weeks, you can be able to do your own urine test at home. If you're not sure, get a beta HCG test, which is the blood test from your doctor, who will be able to confirm to you that you are or you're not pregnant. I wish you all the best, and I hope that you'll join me for the next video, because I'll be talking about during pregnancy and what to do.